So the story really begins in 1975, where John Goodfellow, a surgeon, working with John O'Connor, an engineer, were thinking about the design of knee replacement. And knee replacement, for knee replacement wear was a major problem. It still is. And they wanted to minimize wear without causing loosening. And they observed that it is the normal meniscus that prevents the normal knee from wearing out by having a large contact area, full congruence. So they thought they would solve the problem of wear by introducing a mobile bearing, and this they thought should be fully congruent, and to achieve that they had a spherical femur and the bearing was unconstrained.
I think the general concept or caveat is, as I've kind of lived through 3 decades of practice, I think when you get to unicompartmental replacement, you either believe the concept or you don't. It's not that you can't do it, but I think you have to decide whether it's something you're interested in doing and you're trying to get better at it. My brother designed the first one I ever put in. He no longer believes in it. I believe in it.
So Jim Urbaniak used to say that in traditional orthopedic surgery, we measure with a caliper, we mark with chalk, and we cut with an axe. And I wanted just to lay out one of the concepts, and I learned this from David Stolberg, one of the concepts about computer-assisted surgery. You heard some of these talks during Wick's session this morning that we need better planning tools. Well, the big idea with computer-assisted surgery is that we have a set of digital planning tools, i.e. a better caliper, and then we can take that plan, that refined plan, and we have some tool for intraoperative execution. So we have a better chalk and axe.
David, if I have it correctly, you'll accept disease of the medial patellofemoral joint, but not the lateral. Is that correct?
I mean, I think that obviously we did studies like you and come to just the same conclusions that you could ignore it. But when you drill down into it, we did find that actually, however severe the arthritis is on the medial side of the patellofemoral joint, it doesn't compromise the outcome. And that's because, as you say, when you correct the varus deformity, you improve the patellofemoral joint, certainly on the medial side. But on the lateral side, the story doesn't work. If you've got bone on the lateral side, particularly severe damage, then you don't help.